Okay, welcome everybody. So this is a meeting about the upcoming plans for Welsh licensing. Um, and the British Acupuncture Council has been advocating for members for quite a while on this issue. Um, Ian, our research and policy manager, has been fighting for us from the beginning, so he'll be able to give you the full um, uh, run of things up till now. Today is really past, present, and future. So we'll be going through everything that's happened up until now to catch you all up, and then where we've got to at present. Um, we've had some positive results, and but also at the same time, the licensing scheme is still going forward, and so there are some aspects of it that will present a challenge to members, and we want to lay that out, and then we'll look at the future and what is the possibilities that are still on the table and what's not really still on the table. So hopefully, we'll give you a full and frank description of what's going on. But we know this is a really difficult area for members, and we just want to find the best way to support members at this time, as well as hearing from you. So at the end, you'll have the opportunity to ask questions and make points and suggestions, so that we can find the best way moving forward together. So without further ado, I will pass over to our research and policy manager, Ian Appleyard, and
Okay.
he will take us through what's been happening up till now and then looking forward.
So we're going to go through where we're at. So this is BAcC Direct. Obviously, Alex just introduced himself. We've also got Paul Burdon around, who's communications manager at the moment, and as many of you will know, is a member in Wales. So today we're going to go through some of the history, and it's all really the history is just to recap for those of you who may not have been in webinars we've had before or had chance to read the feedback that we've given to the two consultations so far. But also, I guess, to refresh our minds about what's gone on, what we've put forward, what are the problems with the right licensing regulations as presented at the moment, and try and understand collectively what we can do at the next step to make things better for yourselves, but also I think for patients in Wales who I believe are potentially going to be disadvantaged by some of these proposals. So the history will cover the background to licensing and then recap on the two consultations, recap on other activity we've been doing, just to let you know that sort of in between consultations, we continue to try and have influence and speak to people who've been involved in developing the regulations and put out what we feel are sort of the achievements so far. And then the next step, the regulations do have to go through the Senate. So we will have a proposal for what members can do on that. But again, just to emphasize, very helpful if you have feedback and knowledge that we do not have. And then other support that we plan to give members. Okay. So I thought it'd be quite useful to go right back to the very beginning. Licensing. Why do we have licensing for acupuncture and tattooing and ear piercing? And quite interestingly, in some ways, considering by and large now acupuncture is probably considered a lot more safe, considering certainly in terms of the spread of bloodborne viruses. But it was actually acupuncture and the outbreak of hepatitis B in Birmingham in 1977 that really kicked off the desire to have licensing for these special procedures. So this is taken from Hansard, the Birmingham Yardley MP of that time, Sidney Tierney, talking about what it was. And I think it's quite useful to remind ourselves of the context. Obviously, hepatitis B is a dangerous condition and has long-term consequences. So that's the underpinning of why the government sought to protect people from unhygienic delivery of acupuncture and stuff. But I thought it's quite interesting that at the time, the MP was saying, I do not want to dwell too much on tattooing and ear piercing, which is slightly different to Wales because it's the tattoo parlour outbreak of pseudomonas that in some ways has prompted this licensing. Okay, so the legislation developed, and so 1982 Local Government Miscellaneous Provisions Act, which is amended 2003, it basically gives local authorities the power to license practitioners or demand that they should license. And then we've had other licensing procedures that sort of sit over the top of that, one in London, then in Scotland, and now Wales is termed. So that's why acupuncture is grouped with tattooing and piercing. It's coming from a root, it's got a history behind it. So we're dealing with Public Health Wales Act 2017, Part 4, Special Procedures. So you can sense probably from that, I think this probably plays into how the process has been dealt with so far. The Act was passed in 2017, we're now 2024, and the regulations haven't come into place. Now, I'm not overly familiar with how long these processes normally take, but I do think it's obvious, it seems to be taking a longer time than anyone anticipated. And so sometimes when I've been talking to people within the Welsh Government, the sense is that they really just want to get it done, which is a bit of a problem for us because it means they're less receptive to ideas of there's a problem with this. We have some information, and I thank people like John Wheeler who were working on this for the BAcC long before I joined the BAcC as part of the office team, but I was a member back in 2016 and beyond, because the British Acupuncture Council's clearly stated within what the intention of the bill was meant to be. And that may be quite important or helpful for you if you have the chance to speak to your assembly member, because in some ways I would say the regulations as proposed don't really meet the intention of the Act. And so they may be reticent to have any change to the regulations or find it difficult, but you may be able to get more of a sympathetic ear if you point out, well, actually, initially the whole intention was that literally written in for the members of the British Acupuncture Council to be exempt from the requirements to obtain a license, so long as we remain with accredited registered status with the Professional Standards Authority. So that's quite important. The other thing that I noticed in this document, which I believe the regulations are not genuinely adhering to, is that there was an expectation that the licensing would be tailored and specific licensing criteria that relate to individual special procedures. Naturally, because there is a great deal of a variance that needs to be taken account of because tattooing and acupuncture are different things. And again, when I've spoken to people from Welsh Government, sometimes I feel it's they don't really want to make any exceptions. And so potentially we can point to what the intention was to your assembly members and say, well, it was always meant to be that the licensing arrangements should be slightly different or differing depending on which special procedure was being licensed. Okay, so then, of course, we did have the actual Act itself. And if you don't know, you can go and look at the whole Act and all laws in the government on the website, on the government website. And sure enough, it was in that you could be exempt if you're on a voluntary register that is accredited by the PSA. So that's an important thing to remember. So the first consultation came out and we responded to it. So we just recap on what we fed back to them and what we said was the problem with the licensing. So there's a couple of good things which are in green. Of course, it's to focus on hygiene, which is important for acupuncture. And even if we feel that it's extremely rare for acupuncturists to cause a cross infection or anything, that we should emphasize to people is part of our success. It's because a great many acupuncturists have been through the BArB accreditation process. They've been well trained, they've joined the BAcC, they've adhered to the professional codes. All the work that's been going on for 20, 30 years now has helped keep the public safe. And that's something that all of us should be very proud of and feel very proud to be a part of. It doesn't mean acupuncture can't cause cross infections. Of course it can. It pierces the skin. The other problem that we generally find, and Hannah, the Safe Practice Manager, can speak more at length about this, is that there is already quite a considerable variation across the country. We have different local boroughs applying slightly different, having different approaches and quite different costs sometimes for members to actually get a license. So £100, but I believe in some areas, even within England, it's £800-900 to get a license. So there is variation, which is generally considered not a good thing. So having a national licensing scheme should be good. So there's sort of two things to welcome. But the problem with the licensing scheme is it doesn't have any assessment of knowledge and competence beyond hygiene. It doesn't have any sort of way to assess professional conduct or deal with professional conduct hearings should they arise. And environmental health officers don't necessarily know that much about acupuncture. And we know this again because Hannah often has calls from environmental health officers asking her about what they need to ensure is in place to license acupuncturists within the UK. Naturally, environmental health officers are doing a lot of other things, and acupuncture is not the main part of their daily work. So these are the limitations of the licensing scheme. So there is, of course, a risk in the National Register is when somebody comes and asks the question, how do I find an acupuncturist? The belief and what we fed back to the Welsh government is that they will assume that they get the sort of three green lights, if you like, that the person is competent to provide acupuncture in a hygienic way, that they have knowledge about acupuncture and other issues, red flags, etc., and they will act in a professional way, because that's the standard expectation that you're going to have from any healthcare professional, whether it's a nurse, a doctor, physio, occupational therapist, radiographer, etc. So having a national register that is public in this way raises the risk that people will assume that it gives them kind of a protection against unprofessional behavior or someone who simply doesn't know very much about acupuncture. So that's the key risk, one of the key risks we've raised to the Welsh Government. The other risk of the National Register, of course, it costs. So your sort of on-cost expenses, if you like, for running an acupuncture clinic can go up. And having worked in a rural area at some point in my past, I can understand that sometimes you drive to one place for a day. That village doesn't really have enough in terms of population to support a full clinic, but you move around. And obviously people find it poorer public transport, etc. So it might be difficult for people to run acupuncture clinics in areas that are relatively poor because people won't be able to pay as much or aren't able to pay as much. Rural areas where there's not enough population to sort of support 5 days a week. And of course, it's going to affect people who have reduced mobility. So if you live in a village and you need to get to the local town, but then the person in the local town doesn't want to run the cost of a clinic in that local town and moves to concentrate on their other practice, then that's a withdrawal of service. So that is obviously not fair, and there's potential damage in and of itself, but it may have a knock-on effect of driving more people to see their GP who can no longer get acupuncture services. So these are two key risks we've identified and fed back to the Welsh Government from the first consultation. We've also highlighted information that comes from the actual research that we have to date that acupuncture is safe. And obviously, you know that it's safe, but, and these are the research papers that are significant in this regard, research does show acupuncture is safe, but when delivered by a properly trained practitioner. So the research obviously does not show, I'm not aware of any research that specifically looked at untrained practitioners, but the research does show that it's safe when someone's been fully trained. So what we've pointed out, even though there's their perception of acupuncture may be that it's very safe. Again, to reiterate, that is partly due to the success of the British Acupuncture Council, the collective work of the BAcC members and of BArB to make sure that a significant proportion of people delivering acupuncture in the UK for a substantial length of time are well trained. And we have collectively protected the public from many of these things. But there are things that can go wrong. So obviously pneumothorax, an infection, myocarditis is possible, nerve damage is possible. And what I put in here is kind of a slight difference in some concept between a side effect and an error. So most of the side effects you actually can't avoid. Somebody is going to feel tired after after treatment. They might feel a bit faint. We can minimize these by some knowledge, make sure that they've eaten, they're not hot, etc. But the errors like pneumothorax are more and more become due to poor training. So it will matter. And that's again, if you get in touch with your assembly member, let them know it does matter. Other safety concerns that have been raised is sort of delayed diagnosis and encouraging patients to stop medication. This was actually specifically looked at by a research paper done by Hugh Macpherson some time ago. And again, BAcC should be very proud of this because the people that took part in this research or provided the patients to do it were the British Acupuncture Council. So almost a third of the BAcC members at that time took part in this research, over 600 people. And one of the things they found is that there was no evidence that people were being encouraged to stop medication without speaking to their GPs. And there was no evidence that seeing a traditionally trained acupuncturist was delaying diagnosis. So we do have the evidence, but again, the heavy caveat has to be that is on fully trained traditional practitioners delivering the acupuncture. So these are the things that we've tried to put across to the Welsh Government, and we really need to continue doing so. There is, of course, a solution, and that is to preference, in some way, professional standards authority accredited registers, of which at the moment the BAcC is the only one. And what does PSA accreditation show? It means that there's a third-party independent body that's specifically set up for this purpose, which the Welsh Government signed up to, along with the other three nations, to enable members of the public to access healthcare from non-statutory regulated professionals. But what it does do is verify that our complaints procedure is actually a genuine complaints procedure. It's not just something that is a PDF or empty words. People have a genuine chance to raise a concern, which protects the public, and that complaints thing also is fair to the practitioner. We have all of these codes, etc., that we've been developing over years, which has a cost attached to it. You know, these codes don't come from nowhere. And then we've got on the left-hand side of the screen quite a complicated process of accreditation of courses, of all the membership drawing together, paying their subscriptions, which significant part of BArB, etc. So this independent verification, this system to protect the public has been established there for some time, and it's not really being utilised within the Welsh Government regulations, even though the Licensing Act, the Healthcare Act of 2017 specifically mentions you don't have the PSA accredited status. So, second consultation, truth be told, probably I felt when we got the feedback from the initial um, first consultation, that's their feedback on everything that people are in, that we weren't being really listened to, and it was largely ignored. Um, when I had the opportunity to go to Wales for the conference that they organised, I spoke to people from other professions, tattooists and the cosmetics. And we weren't alone. Basically, a lot of people felt that the feedback that they had entered into the consultation process wasn't being wasn't really touching their sides, and they were just carrying on regardless. As an example, what they said when they came back to us, because one of our main drivers was to say, don't just believe us to say that the BAcC does all of these things. We have an independent body. We've signed up to the PSA accreditation process who independently verify that we are running our systems, governing, supporting our members correctly. That's what we said. And yet when they wrote back, they said to attempt to grant exemption to one professional body and not another based solely on the body's own estimations, which is direct opposite of what we'd actually argued. So it was definitely felt like they were not listening. So the second consultation process was based on the written up legislation, and that's what it looks like. It's a bit harder to read, to be honest, unless you're proficient in legalese stuff. And the risks remain effectively. So when people ask the question, how do I find an acupuncturist? The regulations are not protecting them from people who have no knowledge or competence, including knowledge of red flags or willingness to refer when appropriate. They have no protection against unprofessional behavior, abuse of the power structure, etc., etc. They've only got some protection in terms of hygiene, but in my estimation, it doesn't equate to a BArB accredited course where you have the ongoing education in acupuncture and clinical experience compared to a short course a day. Okay. There was also became apparent the risks to the availability of home visits because at that time, in the initial during this consultation, it was quite clear that it would be almost impossible to provide acupuncture in people's home unless they were so-called in palliative care, which was rather vague. So since that time, we've been continuing to get in touch with Sarah Jones and Lynn Regan, who took her place for a while. Hannah and I went to the conference in Llandrindod. We've had continuing communications with Welsh Government. It's something that Alex prioritised and he wrote, and it was very good that he did because we've got some good information back. We also did the SNAP survey on home visits. So thank you all of those who took part. I honestly believe that having some concrete examples really helps when we fed that back to the Welsh Government. And we continue like now to seek advice from the Welsh members. And I think you know who you are, but those people who've been helping me, I do say a big thanks because the more insight we can get and different points of view, it really helps us, I think, find a good path forward. So the achievements so far, the biggest one, as it said, Alex got the letter back, an email back to say they're going to have no restrictions on home visits. So I'm pleased about that. It feels like we got some traction there. When I was in Wales for that conference on the 1st of May, talking to people, over the day, I genuinely felt there was a shift that they really began to understand that there was a risk that everyone in Wales, the public, are going to see this register as a guarantee of a sort of more comprehensive safety that includes professional conduct, which included knowledge. So they were making much more stronger mood music to say that they were going to put caveats on the website saying this is a limited thing. But unfortunately, what they've been unwilling to do at the moment is to say that they're going to put on, if you're looking for an acupuncturist, go to the PSA accredited registers. There's a very clear-cut precedent, as that's what's on NHS Wales. If you go to the website, it says, you're looking for an acupuncturist, go to the PSA and find someone who's on an accredited register. For whatever reason, well, the reason they've given is if they do that for acupuncture, then somehow they're going to have to do it for tattooing, even though there's no PSA, as far as I know, for tattooing and body piercing. So next step is still to go to the Senate, and we would like members to get in touch with your assembly members and potentially write a letter. So we've drafted a letter, and Paul will talk a wee bit about that in a minute, basically wanting to flag many of the issues that we've raised so far. Our key messages. Now, obviously, we're not going to be sort of Pollyanna-ish about this, and we can't guarantee that at this stage we're going to get these changes. But I think the first thing we would like is PSA recognition on the website where the register is, ideally beside everyone who's a BAcC stroke PSA accredited register's name. It's, I think, a relatively small technical change to do with the website, which they should be able to agree to. So I think this is priority number one, and it would help the public understand all the training that you've had and all the additional layers of security that they get from you being signed up to professional codes. I think we can also make a case that the licensing amounts to double regulation, because there's frankly nothing in the licensing that you haven't done already. So it's just additional costs. And we need to point out that those additional costs, where the acupuncture remains, will ultimately be borne by the patients, even if it's just £1 or whatever. If that's a poorer area, that's going to have a bigger impact. It may create greater pressures on the NHS or lead to deregulation, because members that naturally think, I can't afford to do both. You have to be licensed. So it takes away, and you kind of lose the status, unfortunately, of having a BArB accredited course, having BAcC accreditation, etc., etc. So deregulation. So you would be looking like someone who'd done a 3-day course potentially, and that's things we wish to avoid. So it's double regulation. Other support that we can put for members, we would looking to provide information on what you need to do next. So that's why we continue talking to Sarah Jones, Lynn Regan, and been working on finding which courses you can do for the hygiene requirements, because there seems to be some courses that purport to be qualifying you, but aren't in reality. So we're really trying to nail that down to understand which one guarantees you meet that criterion. We're of course exploring ways we can partner with any particular organization to provide the training to our members more cheaply. And Hannah, Safe Practice Manager, is going to develop a risk assessment tool for Welsh members needed for the home visits. Questions and answers. So I shall stop sharing.
So yeah, I'll pass over to Paul in a moment. He's going to say a few words about the letter. Just to say a few words about the PSA. I think that members will have questions. Did the PSA actually fight for us? What's the value of the PSA in this situation? Because part of our accreditation should be that they should advocate for us in these situations. I had a meeting with the CEO of the PSA in June, also the director of Communications and Director of Accreditation, PSA, was there. I was there with our current chair, Pia, and one of the governing board directors, Mark, who also used to work for the PSA. I think that in my dealings with the PSA now, I do actually believe that they did fight for us on this issue. And I think that anyone who has experience in the bureaucracies of government and the licensing health sector know that there are always competing institutions and voices, and sometimes things don't go the right way. Things aren't done particularly the right way, and good voices are ignored, unfortunately. And this is one of those situations. It still raises a question: how much leverage does the PSA have in this situation? And the reality is that the PSA has a lot of leverage in some situations and less in others. I've seen the reason why I think that I do have trust that they did fight for us is I've seen them in other situations really fight for the accredited registers, and it's really a key part of their strategy. Last week I was in the meeting, Westminster Health Forum, a government consultation on the national workforce crisis, and I wanted to be there to see what their strategy was. And the CEO of the PSA was invited to that meeting to speak as one of the main speakers, and he spent the entire half an hour advocating for the accredited registers. So it's a complex, nuanced thing. And just one thing I want to highlight is that I'm going to go into an honest evaluation of the PSA on 23rd of October in the BAcC Direct, 23rd of October. It's called The Trust That We Project as BAcC Members, where I'm going to go through everything I think that the PSA has done for us, everything that the PSA, where we think the PSA could have helped us a little bit more, and then what the future is. So if you want to answer that bigger question, I just recommend you come along to that meeting later on. For now, I'll just hand over to Paul, who's been working on the letter to go out to the Welsh Assembly, and then we'll hand over to everyone here to ask questions about any of this. So Paul, I'll hand over to you now.
Okay. Thanks, Alex. Hi, everyone. Just really brief about the letter. So the letter, the strategy we decided with the letter was that there's a kind of short-term, long-term thing here. So the goal of the letter is to try and is to give us the best chance to achieve the sort of achievable short-term goals. So really relating to what Ian flagged up about in particular, trying to get our PSA accreditation attached to us, ideally as individuals on the register. So what the letter isn't doing is making a bigger argument about licensing and kind of whether we should be part of the licensing, because right now, so, when we spoke to people, so we spoke with John Wheeler, who has quite a lot of experience of dealing with this kind of stuff, and other people. The argument was, look, they are not going to change the bigger thing right now because it would just involve losing way too much face. So we've chosen to focus on the things that we feel we can achieve in the short term. And now is a particularly good time because it still does need to be debated in the Senate. And so we've got that chance to get our Assembly members to kind of speak for us, which is a different voice. And I know many of you wrote to your Assembly members before, and the responses that we got back were wait for the consultation. And so we were kind of fobbed off. Whereas now they can't give that answer. So we've tried to make the letter sort of digestible, because obviously Senate members are very short of time, and if we send a massive thing, then they just won't read it and we won't get any traction. So we've tried to balance making our arguments and giving detail with keeping it manageable and giving you something that you can use. So there's a few little bits in it that you might need to edit. So there's one line that's like, I wrote to you previously. So obviously if you haven't written to them previously, obviously delete that. So you just want to scan through it. Obviously it's up to you what you send, and it's entirely yours to edit. But with a strong sort of recommendation would be to keep it really focused and not to get into the bigger arguments about whether we should be licensed, because the licensing is happening and there is nothing we can do about that at this point. And when Alex speaks about the PSA, actually, I've come to recognise that actually being licensed itself is not really our problem. It's the recognition of the PSA, and so that is one of the focuses of the letter. So there's things that that we'll still be working on in the long term with that. So that's kind of really it with the letter. But when it goes out, do feel free to to email and ask questions about it if you want to. And obviously it is ultimately up to you. But I think the more the more assembly members we get asking similar points, that's going to help have a coherence to the argument, and it's be harder to ignore. So yeah, the other thing is that with regards to the courses, so there are some courses that look really, really similar to the one that we actually need, and they're not. So there is a level 2 infection control course online, which isn't in level 2 infection control for special procedures. So probably by next week, I'll have got a comprehensive list of these are the ones that we can do. And I've spoken to different people, and some of them are just not online. They're in the list from the Welsh Government. They're not actually running the course, so it's a bit flaky. So I've tried to kind of boil that down, so that will be coming as well. So you don't have to kind of do that legwork. Yeah.
Thanks, Paul. So this draws to the end of the presentation part. So if you're watching this later as a video, thank you for watching. Do look at e-news announcements as they come out, as there'll be more updates for the for developments as they happen, but also all the resources that we've been talking about.